Hey y'all, Chad Robbins here with Robbins Plastic Surgery, doing a weekly skinny. Today, something we get asked commonly. It's about gynecomastia treatment. And so gynecomastia, as you all know, is when men have more breast tissue and unwanted breast tissue. And so, as we talked about before in previous blogs and the resources, this is usually idiopathic gynecomastia, although sometimes we know what causes it. But at any rate, the treatment is the same, which is to remove the breast tissue. In thinking about how we approach this particular problem, there are two main techniques that we use. One of them, which is the minimally invasive technique, and we've got some videos and educational material out there on that, just goes in through, we go through the side here, just do some liposuction and make a tiny scar on the bottom to remove the breast tissue. And if you're a good candidate for that, you have to have good skin elasticity. That technique is dependent, and the quality of the outcomes with that technique is dependent on the quality of the skin and how elastic it is and how much it is. We're expecting that skin to redrape smoothly over the pec muscle. But for a lot of guys with more breast tissue, guys with bigger amounts of breast tissue, and guys who have had weight fluctuations, or you get to be in my peer group and beyond where your skin elasticity isn't great because you're in your 40s and 50s, you cannot expect that skin to redrape very well. You'll be left with hanging and loose skin if you just go in there and remove the breast tissue. So I just want to draw out for you the technique that we use in those situations. That's a technique where we make our cuts like this, and we take the nipple completely off. We take that central portion of it, take it completely off, and then remove all of the breast tissue and skin from the bottom. We actually, as we dissect all this breast tissue to take it out, we go up. So we're taking out all the breast tissue. That way it does not come back. But we then bring this edge of the skin down and we sew it up so that that's in a crease right here, which every guy has, your inframammary crease, and that's where you want it to be. You want it to look like this, not like this. And we take this nipple and reattach it here as a graft. That's called a free nipple graft or a nipple graft. And when you do that, you have to keep it dry for a week while that nipple takes hold there and grows into the skin. So this is a great technique. Because a lot of times, whereas you would take this breast tissue out, and these guys would have loose, sagging skin, the skin's tightened because it's been completely removed, and you get a really nice masculine redraping of the skin over the pec muscle. Now sure, you do that at the expense of the scar and the inframammary crease, but over time that scar fades. If you want to see pictures of that, you can check them out on our photo gallery. Thanks again for checking with us and tuning in, and we will see you later.